The Next Generation NClex is a comprehensive examination designed to assess the knowledge and skills of aspiring nurses. The examination covers a wide range of topics, including patient care, pharmacology, and nursing processes. One of the key components of the Next Generation NClex is the case study question. This type of question presents a real-life scenario to test the candidate's ability to analyze and solve complex patient care problems. The case study question requires the candidate to demonstrate their critical thinking, problem-solving, and clinical decision-making skills, which are essential for effective nursing practice. Let's see the patient's history for case study. A 65-year-old male patient has been admitted with symptoms of shortness of breath, cough, and wheezing. He has a history of smoking and asthma. Nurse's notes reads as, observed shortness of breath and wheezing while breathing. Chest sounds congested with wheezing and crackles. Pulse rate elevated at 120 beats p.m. Blood pressure is 90 by 60 meters mH. Oxygen saturation is recorded at 88% on room air. Physician's orders to do ABG test to evaluate acid-base balance. Chest X-ray to evaluate lung condition. Spirometry to evaluate lung function. Nebulization to relieve wheezing and shortness of breath. Bronchodilators to open up airways. Lab values of ABG test results is given as pH 7.25, PaCO2 50 millimeters, HCO3 to 20 milli equivalent per liter. Oxygen saturation 88%. What condition does the patient have based on the ABG test results? A. Respiratory acidosis. B. Respiratory alkalosis. C. Metabolic acidosis. Metabolic alkalosis. Answer is A. Respiratory acidosis. The patient's ABG test results show a low pH of 7.25, which indicates acidosis. The elevated PaCO2 of 50 suggests that the acidosis is caused by decreased ventilation. The bicarbonate levels are below the normal range, which shows that the body is compensating for the acidosis. The oxygen saturation is also below normal, supporting the respiratory acidosis diagnosis. The patient's history of smoking and asthma further supports the diagnosis.